How's it going, guys? Past level question, Cardiopulm, step 1, internal medicine surgery, 2CK. 41-year-old woman, she's in hospital following a C-section 2 days ago. After getting up to go to the bathroom, she experiences acute onset shortness of breath. She has sinus tachycardia. And then questions asking if death occurs due to failure of administration of appropriate pharmacologic therapy, which the following is the most likely mechanism of patient demise. Now, this is past level for pulmonary embolism, okay? And the most common thing you're going to see on USMLE is sinus tachycardia. S1Q3T3 doesn't exist, okay? So it'll get you questions wrong. You're going to see sinus tachycardia, acute onset shortness of breath. They don't have to mention anything about a DVT, okay? It's even though clearly the thromboembolus originates from DVT going to the lungs, and then you're going to do heparin/enoxaparin, and you would do CT almost always to diagnose first. It's a long discussion. Point is, we have a PE. So if death occurs, what's the most likely mechanism? Let's just hop through. Choice A, decreased left ventricular contractility. Wrong fucking answer. Clearly, PE has nothing to do with this. This could be myocardial infarction. Wrong fucking answer. Choice B, increased pulmonary capillary wedge pressure. Wrong fucking answer, because PCWP equals left atrial pressure, and in pulmonary embolism, our left heart is normal. Choice B, wrong fucking answer. Choice C, pulmonary shunt. Wrong fucking answer. So those of you studying for step 1 who are weak on dead space for shunt is low V on Q, ventilation over perfusion. Dead space is high V on Q. Q is perfusion. So if you have low perfusion in the setting of pulmonary embolism relative to your ventilation, you're going to have a high V on Q. That's dead space, okay? So pulmonary embolism is dead space. Shunt, wrong fucking answer. Choice D, TNF-alpha, mediated vasodilation, vascular permeability. Wrong fucking answer. So this could refer to ARDS, sepsis in general. You should know TNF-alpha is the cytokine that mediates vasodilation, low blood pressure, vascular permeability. IL-1 is the cytokine that mediates fever. Wrong fucking answer. Choice D, ventricular fibrillation. Correct answer. Past level, as I said. So you're going to have a thromboembolus going to the pulmonary arterial circulation. It could be a saddle embolus. It's going to cause acute left heart strain due to severe increase in afterload on the right ventricle, precipitating a ventricular fibrillation. Okay, so there's 3 conditions for USMLE where they want you to know VF is the mechanism of death, pulmonary embolism, acute right heart strain, as in this case. Number 2, myocardial infarction. So most common cause of death after an MI. Long discussion, okay? If they give you a vignette of tamponade as an example, I mean, obviously that wouldn't be ventricular fibrillation, but if they just ask you most common cause of death following an MI, it's going to be ventricular fibrillation. And then the third is hypertrophic obstructive cardiomyopathy, where left ventricular outflow obstruction produces acute left heart strain, leading to ventricular fibrillation. Correct answer. You know the deal. I'm going to make more content. If you like my stuff, subscribe to my channel. Appreciate your time. That's it.